Okay, Assalamualaikum everyone. Good morning. We're back again for the discussion for the clinical. We have encountered and done with the medication administration, oral medication. Now we are into ophthalmic, otic, nasal, and topical administration. But before that, we have to remember what we call the 10 rights of medication administration. Why is it important? Again, it is to reduce medication error or to prevent harm to the patient. Don't forget to remember the 10 rights of medication administration, okay? So what are the 10 rights of medication administration? The right patient, the right medication, the right time, the right dose, the right route, the right assessment, the right to refuse from the patient, the right education, the right evaluation, and of course, the right documentation. Now, we have the oral route that we have discussed last week. Today, for this week, we're going to discuss 4 different routes, which are ophthalmic, otic, nasal, and topical. We start first the first topic, which is the ophthalmic. Ophthalmic came from the Greek word ophthalmikos, which meant eyes. It means eyes, okay? So if you encounter the word ophthalmic, it means eyes. By all procedures, remember the first 6 steps in all procedures. First, we have to verify the doctor's order and other documents such as the MAR. What is MAR? The Medication Administration Record. Of course, you have to introduce yourself and don't forget the 3 V's. The 3 V's again is verbalization from the patient, visualization by the healthcare provider or the nurse while looking at the ID band of the patient, and of course, verification, comparing from the ID band of the patient to the medication administration record or the doctor's order. Of course, you have to maintain client's confidentiality and privacy. How? By pulling the curtain or closing the door. After that, we have to explain the procedure to the patient or explaining the procedure and the purpose. Definitely for ophthalmic procedure, what is the purpose? To provide an eye medication to the client which requires, for example, antibiotic for the patient in order to treat infection or other reasons. Once you have explained the procedure, you have to ask for the consent of the patient. Once the patient agrees, therefore, you have to now collect relevant assessment from the patient. As you see here in these pictures, you have to assess or evaluate the appearance of the eye and surrounding structures such as lesions, exudates. Exudates means discharges. Erythema means redness of the eyes or swelling of the eyes. Also, we have to notice any discharges from the lacrimal area or swelling of the eyelids. What is the eyelids? This is the lower eyelids of the client, and this is the upper eyelid of the client. So what you're going to observe also is you have to observe the opening of the lacrimal duct or what we call lacrimal duct hole. You have to notice that it should be without any swelling or redness. By the way, your tear or lacrimal gland is found on the corner of your eyebrow or on the top of your eyes. Now, if you notice in this picture below, the puncta duct hole of this patient is swollen and has reddened, meaning say it could be a blockage on the duct of the puncta. We have to also assess, aside from the appearance of the eyes and location of the lacrimal area or swelling of the eyelids, number 3 is you have to ask the client if he or she has itching, hasassia, burning pain, or had experienced what we call blurred vision or photophobia. Photophobia is fear of the light. Another is you have to observe the client for any behavior of squinting, blinking, frowning, or rubbing. What is squinting? Squinting is like this. Okay? And then blinking, of course, excessive blinking. Please take note of this, excessive blinking and frowning. And rubbing of the eyes. After collecting the relevant assessment from the client, therefore, we have to collect now our equipments. What are the equipments needed? We need our clean gloves, sterile absorbent sponges or pads. We have your medication for the client, and sterile eye dressing as needed. Okay, the most important thing here on the ophthalmic installation is the eyes, absorbent pads, and medication. Now we have to go down to the patient, but before that, of course, we have to follow the 3 checks or identifying the right medication for the client. Call for the second nurse as per the hospital protocol. Read the MAR against the medication that you are taking. So do the first and second checking. Now, we have to go back to the patient, and again, please encircle this on your clinical manual. Re-identify the patient, okay? Now, when you go to the patient and you have re-identified the patient, you have to ask the patient to a comfortable position. It's either sitting or lying position. After that, first, before we put the medication, we have to clean the eyelids and eyelashes. But basically, you have to please encircle this, put clean gloves and use cotton balls to moisten with cotton balls moistened with sterile irrigation or sterile normal saline. We have to wipe it from, this is the inner canthus, going out to the outer canthus. If you notice on this video, the patient is opening his eyes. But when we instruct the client to close his eyes. Please take note, as we clean the eyelids and eyelashes, the eye should be closed. Next, we have once we have cleaned the eyelids and eyelashes, we have to ask the client to look on the ceiling. Plus, we can give him a dry or sterile absorbent sponge on his hand. And if you notice, the nurse is pulling or exposing the lower conjunctiva using his thumb. You can use the thumb or your index finger while pulling the lower conjunctival sac. Also, if you notice, she is not pressing around the periorbital area but pulling the skin into the client's cheekbone. Why? To prevent intraocular pressure to the eyes. So when you pull the skin, you pull the skin using your non-dominant hand. What do you mean by that? If you are right-handed, your right hand is your right-handed, meaning to say you're using most of the time your right hand. Writing, cooking, or eating, you're using the right hand. So you are right-handed dominant person. So your non-dominant hand now is your left hand. Okay? So the thumb of this nurse she is holding or she is pulling the lower conjunctiva using the left thumb. Okay? Her left thumb, the non-dominant hand. Okay, now gently drawing down the skin on the cheek. Gently. Do not pull it too hard. Okay? Now, your dominant hand, you have to put it on the forehead of the client while you are holding the medication. And the medication should be how high? It should be between 1 to 2 centimeter. The tip of the dropper should be between 1 to 2 centimeter away from the lower conjunctiva. Okay? So if you notice here on this video now, the nurse is holding the dropper on the top portion. But before that, please take note, please discard the first drop before administering to the eye of the client. Okay. Now, I would like to emphasize that when it comes to eye drops, it depends on the doctor's order, but hold the dropper 1 to 2 centimeter away from the lower conjunctiva or 0.4 to 0.8 inches above the lower conjunctival sac. While for the eye ointment, hold the tube and squeeze 2 centimeter or 0.8 inches of ointment from the inner canthus out going to the outer canthus. Please take note, by the way, I would like to emphasize, as you pull this lower conjunctival sac, please divide it into 3 parts. So 1, 2, 3. So this is 1, 2, 3. When you pull the skin down, you have to drop it on the lower third portion of the lower conjunctiva. So imagine you divide the lower eyelids or the lower conjunctival sac into 3 parts. 3. So 1, 2, 3. So where are you going to drop the eye drops? You have to drop it on the lower third portion, lower outer portion. Okay? Please take note on your clinical manual. Now, if you notice here on this video, this patient is applying an ointment from the inner canthus to the outer canthus. Plus, we have instructed the clients to close the eyelids. Here is the left eye. See, he just closed the eyes. He did not squint or tightly close the eyes. Or do not squeeze them to shut, not too tight. Just gently close the eyelids. Now, if you notice, again, he put the ointment on the eyes from inner to outer canthus. Plus, we ask the client to gently close the eyes but not to squeeze them. Why? The ointment will come out. When it comes to, this is ointment, okay? When it comes to eye drops, when we put the medication, we ask the client or we press firmly on the nasolacrimal duct for at least 30 seconds. Please encircle again in your clinical manual. Please press the nasolacrimal duct for 30 seconds. Where is your lacrimal duct? This is your lacrimal duct hole. So you have to press on this area. Can you see this on this video? I'm encircling it. Okay. You have to press this area or ask the client to press it for 30 seconds. Clear? Now, after that, of course, you have to provide health education, document, observe universal precaution, and evaluate the client. For our second topic, which is the otic. Otic came from the Greek word otikos, meaning to say ears or your udun. Again, you have to follow the basic top 5 procedure, verifying the doctor's order, introduce self, patient identification, universal precaution, and privacy of the client. How do we explain otic installation? What are the purpose? The purpose are, number 1, to shrink swollen mucous membrane to the client, to lose secretions, to facilitate drainage if there are impacted cerements or earwaxes to the ear from the ear of the client, and of course, to treat infections of the ears. Please ignore this part. Number 6, collect relevant assessment data from the client. What are the things that we need to assess from the client? Of course, we have to assess the pinna, the upper part of the ear, and meatus, the opening, external auditory canal of the patient, for any signs of redness and abrasion. Why? Because during the procedure, we're going to touch the ear by pulling it up and backward or down or backward. So we have to make sure that the client will not feel any pain during the procedure. So we have to assess for any redness or abrasion. Of course, you have to assess what type and amount of discharge that comes out from the external auditory canal of the patient or the opening of the ear. What are the equipments that we need for otic or ear installation or ear medication? One, of course, is your clean gloves, followed by your cotton tip applicator, your medication bottle, as much as possible. If there's a chance to have a flexible rubber tip, especially for patients who are keeps on moving or to prevent them from having injury from sudden motion, especially for kids and disoriented client. Then we have your cotton fluff, and this is your cotton ball actually on the photo. Cotton fluff means loosened cotton, okay? Not compacted cotton, it's loosened cotton. Okay, now of course you have to call for the second nurse to do the 3 checks. First check would be getting the medication from the storage, and number 2, before going to the patient, okay? Then, when we go to the patient number 9, return to the patient and re-identify the right patient. Number 10, assist the client to a comfortable position for eardrops lying with the ear being treated. For example, on this video, the client's ear affected is on the is on the left side of the patient or the left ear of the patient. Before that, you have to position the bed, or the height of the bed is according to your height and according to your position. So the affected area now here is on the left ear. So we have to ask the patient to turn to the right side. You have to wear what? Clean gloves, of course. But before that, for number 12, while waiting or while preparing for the equipments, while cleaning the ear of the patient, make sure to warm the medication in your hand or place it in warm water. Why? So that it will be comfortable. The medication will be comfortable as you instill the medication to the ear of the patient. Please take note on your clinical manual. It says here, straighten the auditory canal. How? It depends on the age of the patient. Okay? For number 15, pull the pinna upward and backward and instill the correct number of drops along the side of the ear canal. I'll repeat. For adult patient, you have to pull the pinna upward and backward. Meaning to say, these are 3 and above years old. But for pediatric who are, when they find pediatrics under ears, it means 3 years and below, okay? So how do we prepare the ear of the patient for pediatric 3 years old and below, okay? So it will be now downward and backward. I'll repeat. For adult, it's upward and backward, while for 3 years old and below, it is downward and backward. Okay, let's see this video now. So the nurse is now opening the cotton tip applicator. First, of course, to clean the, you can see the dirt there. You have to clean the opening of the ear. Why? So that we can instill the medication properly. Plus, see, pulling the pinna upward and backward. Plus, you drop the medication along the side of the ear canal. We don't drop it directly to the hole, but to the side of the ear canal so that the medication will go to the ear smoothly. Then, now she is putting what we call cotton fluff or cotton ball. Please take note that we ask the client to what? Remain on the sideline position for 5 minutes. And if there's a need to put a small piece of cotton fluff loosely on the meatus, you have to put it for 15 to 20 minutes only. Please do not forget that. Remember, we're going to evaluate the client after 15 to 20 minutes. So that's the time that you can keep the cotton fluff to the ear of the patient. But please take note that if the patient have or needs to be treated on both ears, you need to wait for 5 minutes each ear, okay? You have to wait 5 minutes each. Then, you have to document, use universal precaution, and evaluate the client. Now, we go on to the third topic, which is the nasal or nose installation or nose application. Nasal came from the Latin word nares, meaning to say nose. Again, we have to follow the first 4 steps. What is the purpose of nasal installation? To shrink and swollen mucous membrane from the patient, to loosen secretions, to facilitate drainage, and to treat infection from the nasal cavity or sinuses. Of course, what are the relevant information that we need to get from the patient? First, you have to assess the appearance of the nasal cavity of the patient, and of course, the nasal mucus for any signs of redness or abrasion. As nurses, it is important to document the type and amount of discharges. If you can see here on this presentation, we have 4 different colors, right? We have clear, white, yellow, and green color of drainage. Drainage or secretions coming out from the nose of the patient. It is clear usually. Sometimes the doctor will say it might be viral or it could be normal from the patient. Next, we have your white. It could be cloudy sometimes. It could be sign of irritated nasal or a bit of infection from the client. It is important to mention if it is either color yellow or color green. Color yellow might indicate infected or infection from the client or colds. And we have the green color. It means a serious infection, and it could mean a need for antibiotic or medicine to be prescribed by the doctor. What are the equipments that we need to use? Of course, we need to use clean gloves, cotton tip applicator. This is cotton tip applicator. This is saline spray, the correct medication, kidney basin, and Inco sheet. When do we use these things? The Inco sheet later on we'll put at the back of the head of the patient. Okay, before that, you have to know first your anatomical position of your sinuses. We have your frontal, just above your eyebrow. We have your ethmoid on your nose bridge area. We have your maxillary sinuses, which is found on your cheekbone, and your sphenoid, which can be found in front of your ear or in the middle of your face as well. How to prepare the medication? By calling the second nurse again and check for the first two checkings. First, getting from the storage or the medication shelf, and number 2, before going to the patient. Now, we have to return to the patient, number 9, and re-identify the right patient using 3Vs again, and assist the client to a comfortable position. What do we mean by comfortable positions? There are 2 possible positions, okay, for this patient. If you notice for ethmoid and sphenoid, we instruct the client to lie back with the head over the edge of the bed, or a pillow under the shoulders. The pillow will be here, okay? So that the head will be tipped, or meaning to say the head will be hyperextended. While for maxillary or frontal sinuses, we will assume that the patient will be lying on the back, but we have to turn the head to one side to be treated. I'll show you one video later. If you notice here, this is your frontal sinuses, which is tilted laterally to the side of the face, and we have your maxillary sinuses. So these 2 sinuses, we have to position how again? On supine position, but the head should be turned to the affected side. While for the ethmoid and sphenoids, we have to hyperextend the neck. Okay, now take note for number 11. Please place the incontinence sheet under the head of the patient. Why? So that in case any drainage, it will not go to the bed, but it will go to the Inco sheet of the patient. You have to make sure that your yellow bag or your garbage bin will be near to you. You have to wear gloves. And of course, you have to clean first the nostril area before giving the medication. How? Prepare the cotton applicator with sterile normal saline and clean the nostrils or opening of the nose of the client. How do we instill medication? Remember, for this video, let's assume that the problem is either on the maxillary or frontal. So we ask the client to be in supine position but tilted to the right side. Why? Because the right nostril is the affected area. Let's say the right frontal or the right maxillary area. So how do we do that? While we put the medication, please highlight on your clinical book, we have to ask the client to what? To breathe through the mouth. Why? To prevent aspiration of medication. So let's watch this video. If you notice, they drop and the patient is breathing through the mouth. Let's do it again. While dropping, the patient is breathing through the mouth. You can ask the client to slightly open the mouth and breathe. And the rationale for that is to prevent aspiration. Once you have given the medication, we ask the client to please encircle, remain in the backline position or supine position with at least 1 minute. Why? So that the solution will come into contact with all of the nasal surface. After giving the medication, nasal medication, instruct also the patient to avoid blowing the nose for several times. Avoid. As form of evaluation, we have to assess the client's response immediately after dropping the medication. Why? Patient could be at risk for aspiration. Once you're done with the procedure or the installation of medication, now we can remove the incontinence sheet and gloves. Of course, you have to observe universal precaution, help educate the patient, document, and evaluate the procedure. Okay, this is not part of your clinical book, but I think it's nice to know how to help educate patients who are doing nasal instillation or self-medication using spray. On this video, I would like to emphasize that we are using nasal drops. It's different from nasal spray. So let me help you read or view the video regarding nasal spray.
Take off the cap and shake the bottle before use. Either sit down or stand up. Put your head in a neutral position unless otherwise instructed by your doctor. In order to avoid nose bleeding, direct the spray nozzle towards your eye or ear. Insert the tip into the nose with approximately 1 centimeter depth. To deliver the complete dose, press firmly along the device, then inhale gently. In case of malfunction, take the device to the pharmacy. Wipe the tip after use with a clean tissue and put the cap back on.
Okay, what did you notice on the video? The nurse is holding the right hand when she is spraying on the left nostril, the opposite side. And when she is holding the medication from the left hand, she put it on the right nostril area. I'll explain furthermore as we watch this video.
Like this. Pull your nostril out with one hand. So my left nostril, I'm going to spray with my right hand, but I'm pulling my nostril out with my left finger, okay? Now, one mistake that many people make is that when they spray it, they snort it in. And so when you spray it and snort it, guess where it's going to go? It's going to go into your throat immediately, and you're going to taste it, and you're not going to like it. And it's not going to be as effective because it's not staying where it needs to stay. Okay, so when you spray it, you don't inhale, you let the medication go in the nose, and then if you need to sniff back a little bit so it doesn't drip out the front, then you do it after you put the spray in. Okay, so once again, you might need to sniff a little bit to keep the medication up in the nose. The proper angle is up and slightly out, so it's almost towards the corner of your eye where you're trying to get that angle. Okay, now I see a lot of people use the right hand to spray both sides, and so what happens is that if you're right-handed, the angle is perfect for spraying your left side. It's not perfect for spraying your right side. What happens is that you end up spraying right onto the wall, that septum, which we talked about earlier, the wall that divides the left and the right side of your nose. And if the spray collects there, it tends to cause an irritation. It can cause bleeding. So that's where we get into bleeding issues with some of these medications. The proper technique for spraying the right side is head down. You pull your right nostril out with your right finger, and you spray just the opposite with your left hand. And you might need to sniff again after you put the spray in. Sniff slightly to keep the medication in the nose. Okay, so that's the proper way of using a nasal spray.
Please take note that the patient will inhale through the mouth, not through the nose, as he is instilling nasal spray. Last but not the least topic will be our topical administration. Of course, again, we have to follow the top 4 major procedures. How to explain the topical administration to the patient. The purpose is what? The topical or skin or dermatological preparation includes how? It includes possible ointment, creams, paste, lotions, powders, and sprays and patches to be administered to the skin. What are the things that we need to ask from the client? We have to ask the client for any history of skin allergies or medications or allergy towards any kind of medication or even food we can ask. What are the things that we need to prepare? Of course, we have to prepare our topical medication. It could be a form of powder, cream, ointment, or oil-based or water-based solution medication. We have a bowl of warm water plus with mild soap. We have what we call washcloth, tongue depressor, gloves, kidney basin, tissues, and dressing. Why do we need mild soap and water? In case you need to, or you're intending to give what we call water-soluble medication, of course, you have to clean the skin or prepare the skin first. As we prepare the supplies, of course, again and again, we have to call for the second nurse for the 3 checks before going to the patients or going back to the patient. First check, getting the medication, comparing to the medication administration record and comparing to the doctor's order. And before going to the client, the second check. Once we return to the client, of course, we have to do what we call re-identify again the patient. Assist the client to a comfortable position, whatever position he wants, as long as he or she is comfortable. Now, we have to place what? The towel under the body part to be cleaned. Okay, to be cleaned. Of course, you have number 12, you have to wear clean gloves and clean the area through what? Soap and water and dry it with a patting motion or dabbing motion. Now, once the skin is ready or pre-prepared, now we can apply application to the skin. Please take note that when we apply topical medication, we always use surgical asepsis, especially when the wound is present. Surgical asepsis technique. Okay, we have different forms of topical medication. It could be a form of powder. So when it is a powder, we have to make sure that the skin is dry. Spread apart any folds or sprinkle the site until the area is covered with a fine, thin layer of the powdered medication. If there's a need to cover the site with dressing, then you can cover also. Number 2, we can use what we call suspension-based solution. An example of this is your calamine lotion. Okay, first, as I mentioned during the last discussion, when we say suspension-based solution, usually we need to shake it thoroughly before pouring or putting the lotion or the solution to the skin of the patient. Why? The medication might be settled on the bottom part of the bottle, so you need to mix it well. Put a little lotion on a small gauze or dressing pad and apply it to the skin by stroking it evenly in the direction of growth of the patient or gently spreading it evenly to the skin of the patient. Number 3, the type of topical medication could be either a cream, ointment, or oil-based lotion. Of course, if this oil, sometimes it depends on temperature, you have to warm and soften the preparation into your glove hands with the use of glove hands so that it will be easier for you to apply and prevent chilling. Remember, if it is oil and it's cold temperature, what happens to the oil? It becomes hardened. So, make sure that you have to warm it first by just holding the medication. So, it will be easier for you to apply later on. Next is you have to smear it evenly over the skin using what? Long strokes, and explain to the client that the skin may feel somehow greasy or sometimes oily. Greasy means oily. And apply sterile dressing in order to apply sterile dressing as needed. Number 4 type would be, we have the powder, we have the suspension base, we have the cream, ointment, paste, and oil-based solution, and then we also have the aerosol spray. For aerosol spray, this is an example. We have the lidocaine topical aerosol spray. Of course, you have to shake the container well to mix the content, or depending on the manufacturer's recommendation. You can see the tip of this aerosol. Hold the spray container at the distance of at least 15 to 30 centimeters or 6 to 12 inches. And of course, you have to check for the label for any recommendation. Depending on the manufacturer, sometimes the distance will be too far or sometimes they will recommend to be near. But as a basic knowledge, we have to keep it between 6 to 12 inches or 15 to 30 centimeters. In case you need to spray on the upper chest or neck of the patient, you need to cover the client's face. Why? To prevent from inhaling the medication. Okay, remember this is lidocaine. So in case you're intending for the upper chest, please encircle this on your clinical manual. Upper chest or neck to be sprayed, you have to cover the face of the client and only spray the medication over a specific area. Do not extend the spray to other parts of the body. Just concentrate to what area needed to be sprayed. And last but not the least, we have your transdermal patch. If you can see on this picture, the nurse is holding on the edge part and not holding on the medicated part of the patch. Of course, you have to select dry area that is free of hair and matches to the manufacturer's recommendation. Now, as you remove the patch from its protective covering, hold it without touching the adhesive edges and apply it firmly with your palm of your hand for about 10 seconds. Why? To make sure that it is placed properly or attached properly to the skin of the client. Please take note that in case the patient is sweaty, you have to clean the site properly or prepare the skin properly. Of course, you have to advise the client to avoid what? Using heating pads over the area. Why? To prevent increase in circulation and possible hindering in the absorption of the medication. And of course, you have to observe universal precaution again. Document and provide health education to the client. And last but not least, evaluate the outcome. That ends our discussion for today. If you have any questions, your respective teachers will be happy to entertain your questions during your online discussion. Have a great day, everyone.